Are you afraid of taking prednisone? It makes sense. I was terrified to take prednisone. When they prescribed it for me, I didn't want to touch it with a 10-foot pole. But I had to take it. I had no other choice. And I wish I had known, even though I'm a pharmacist, the real worst dangers of taking prednisone. And in fact, there's an actual term for fear of taking prednisone and other steroids. It's called corticophobia. My profession of pharmacist ranked the highest in a survey of professionals and their fear of steroids. Prednisone is terrifying to me and other pharmacists for good reason. Let me share with you the top 9 worst side effects, the dangers of prednisone. And I'm going to go in reverse order from the least bad to the very worst. So make sure to stick around to the end to find out what the very worst side effects are, the most dangerous side effects. So the 9th worst in our countdown is insomnia. And this is actually the number 1 tweeted side effect of prednisone. And it's horrible because not only is that insomnia miserable and lonely, but it's interfering with your ability to heal. We need to do our healing from whatever we're taking prednisone for while we're sleeping. And if we're not sleeping because of prednisone, it's terrible. And so insomnia is awful and miserable. In a survey, number 8 worst side effect is skin thinning and easy bruising. Some people have skin so thin that it will just tear. They run into something, like brush up against something, and their forearm skin just tears off like it's a piece of paper. And that's horrible because of the collagen and skin integrity kind of falling apart caused by the prednisone. The 7th worst side effect is infection. Prednisone increases your risk for many infections, but specifically the most devastating for many people is pneumonia. So you want to do whatever you can to protect yourself from the diseases that cause pneumonia, like the flu and COVID. The 6th worst side effect, the most dangerous side effect of prednisone, is cardiovascular disease. Prednisone is affecting your heart in many ways. Not only is it causing high blood pressure, but it can cause arrhythmias that can be fatal. And so, in addition to the pneumonia causing infections that can be fatal, the heart disease can cause fatal outcomes. So that's a pretty dangerous side effect of prednisone. Counting down to our 5th worst side effect of prednisone, and that's hyperglycemia. This is because prednisone is actually named after this side effect. The class of drugs it's named for is called the glucocorticoids. Gluco meaning glucose, meaning sugar. And so it's causing high blood sugar, hyperglycemia. And that's a terrible side effect of prednisone that you don't want to have to deal with. The hyperglycemia can lead to weight gain and diabetes and all sorts of miserable side effects. The 4th most dangerous side effect is called bone loss or osteoporosis or thinning of the bones. Prednisone is affecting the bone metabolism. It's causing your body to lose calcium and lose collagen and other proteins. And together, this is leading to thinner bones that are more likely to lead to fracture. Prednisone is the most likely drug to cause osteoporosis. And so it can lead to hip fractures. It can lead to shrunken height and even bone death called avascular necrosis. Counting down to number 3, our 3rd worst side effect of prednisone is mood changes. I can attest to this because I get phone calls essentially on a weekly basis from people saying, I took prednisone and it's totally changed my personality. I have anxiety, I have depression, I have psychosis, on and on. Any type of mood change can happen from prednisone, and it's terrible and disabling. I always feel so horrible for these people suffering from these mood changes caused by prednisone. In patient surveys, they ranked this as the 3rd worst side effect. And so I can see why. When you can go from a high-functioning person who was able to hold down a job and be a parent to suddenly, I have to go hide in my bedroom and I can't even watch TV. I can't even handle that much stimulation. It's terrible. And no one warns anybody that it's going to happen. No one mentions, hey, by the way, this might cause completely disabling anxiety. That's never a thing that the doctor or pharmacist ever mentions, though they should, right? According to surveys, the second worst side effect that people perceived while taking prednisone is weight gain. Now, weight gain in and of itself isn't that dangerous, right? But the weight gain is so frustrating because it happens almost without your control. The problem is your body is holding on to sodium, it's causing a redistribution of fat, it's causing water retention, and all of these things are fighting against you to cause weight gain. And so it's no wonder that that's the number 2 worst side effect of prednisone. And it leads me to the number 1 worst side effect of prednisone, which is moon face. I personally had to deal with moon face when I was applying to become a medical school professor. It was really discouraging to look forward to my job talk presentation in front of medical students and professors when I knew that I had this big round moon face and big round belly that didn't normally affect me. And so it was hard to have the confidence to go in front of them. They offered me the job anyway, but having moon face is really discouraging because of all of these, it's the only one that anyone else can see. They can't see your mood changes. They can't see your osteoporosis unless it causes a bone break, right? And so the moon face, the fat redistribution and swelling of the face to make it look round like the moon is so unfortunate because it's so blatantly obvious. It's hard to hide it. You really can't. But there are a few things you can do to minimize moon face and these other side effects. If you'd like to know exactly what my best tips are to minimize moon face and all these other worst side effects of prednisone, to minimize the danger of prednisone to you, then you need to download my prednisone checklist. It includes the top mistakes people make and exactly what you can do to avoid them, plus 25 or more tips of precisely how to avoid them. Just click the link below to download it now. Signing off is Dr. Megan, your prednisone pharmacist.